Good morning, everyone. Happy Monday. We are having some fantastic rainy weather in Southern California. Hip hip hooray. So hope you're all having a great day. We're going to talk about newborn behavior today. So this is a big topic that comes up no matter where our babies are born, whether they're born at home, at a birth center, in the hospital, whether we have a beautiful belly birth or we have a vaginal birth. All babies tend to do the same thing in the first 2 weeks of life. We were going to talk about the fourth trimester, which is the first 12 weeks of life. But what I really want to focus on today is primarily those first few days of life, and then we're going to add on some tips for the first 2 weeks of life. So what I want you to know, we see it all the time, and the biggest issue is, so we have these beautiful babies, they're born, and you do all that yummy stuff, no matter where you're birthing the baby. There's often in our wonderful hospitals, we still have skin to skin, the golden hour. Most hospitals delay baths and delay cord clamping to a degree, all that wonderful stuff. So we got this baby, it's skin to skin. We're going to try to establish breastfeeding in the first hour. And some babies are like little barracudas, and they just crawl right up and they latch on, and they're beautiful nursing right away in that first hour or two from birth. Some take a little bit longer. A variety of factors. It depends on how quickly you birthed. If we have super fast precipitous births, sometimes those babies are a little bit shocked. And they're also still working out a lot of amniotic fluid, so there might be a lot of crying, and they're not super eager to latch right away. Sometimes we need to have some narcotics in our labor, which are appropriate for certain reasons, and so babies might be a little bit sleepy. Epidurals sometimes can delay a suck reflex, and then for a variety of reasons, babies may not latch beautifully in the first hour or two from birth. But as long as they are what we call in the habitat, skin to skin on mom, skin to skin on the birthing person, and have access to the breast is what's important. And eventually, all babies have an innate need to suck that is unrelated necessarily, unrelated a lot of the time to the need to eat. So what concerns a lot of family members in these first 2 weeks of life, and subsequently if you're exclusively breastfeeding, what family members or friends, people around you with a breastfeeding person, they're very concerned when a baby cries, the baby must be hungry. Or when a baby wants to suck, that the baby must be hungry. Not necessarily so in these first few weeks of life, because all babies, like I said, have an innate need to suck, unrelated to hunger. So we want to establish breastfeeding in the first 2 hours of life. If that is not established, many babies will go through a 4-hour sleep period. Then after that, we need to wake these babies up. And that means take all their clothes off, sit them up on your lap, rub their backs, rub their legs, pull on their ears, really get them agitated to get them awake so that they have enough vigor to go to the breast. And you should be offering the breast every 2 hours during the day and every 3 hours at night until your baby regains its birth weight. So we talk about this all the time, but what we know is that we don't make milk in the first few days of the baby's life. We make colostrum, and colostrum is in little teeny tiny itty bitty amounts, and we see it in drips. We don't see it voluminously. We don't see lots of pumping, and you're not going to produce an ounce. You're not going to produce even 15 mils, which is half an ounce of colostrum in those first 2 days of life. So lots of skin to skin, lots of opportunity to breastfeed. So everyone can handle the first day. Everybody's really excited. And the baby's kind of sleepy. We'll go to the breast here and there. And whether you're home at this point or in the hospital at this point, the second and or third day of life can be really rough between 10 p.m. and 4 a.m. And those of you that know what I'm speaking about, you can participate in this conversation because we have this conversation all the time. Be prepared for lots of crying between 10 p.m. and 4 a.m. the second and or third day of life. And I promise you, this is unrelated to hunger. It is not what you ate. Baby's not having a reaction to your colostrum. Babies don't have a point of view about what you're eating generally until about the 3rd week of life. okay? So birth to 3 weeks, we're not really looking at colic. We're not looking at an allergy. We're not looking at food sensitivities at this point. And so specifically the second and or third day of life, they are not reacting to the broccoli you ate. They're not reacting to the milk you drank. They're not reacting to the, if you were to have any medications in your birth, if you had an epidural or you had IV narcotics or you were put under general anesthesia or you're taking any pain medication after your baby's been born, they're not having a reaction to that. Likewise, our out-of-hospital birthing babies, they're not reacting to your lotion or your shampoo. They're just crying because that's what they do the second and or third day of life, because they've never digested before. Their skin has never been touched before. They've never seen, they've never had anything, no air on their skin, no clothing on their skin. Sights and sounds and smells, this is all really new to these babies. And there's some level of overstimulation. There's just an issue of digesting for the first time. So we encourage you, babies do not need pacifiers before we recommend no passies for the first 4 weeks of life, but certainly day 2, day 3 of life, no pacifiers. They don't need to be supplemented unless you're under the care of a healthcare provider and for some reason your baby's having a real medical issue. Most babies do not need to be supplemented the second and or third day of life. Colostrum, if you have a normal, everything seems to be normal, babies do not need to be supplemented. We have launched a virtual lactation component. So if you have questions and it's the second night of life and it's the third night of life, if you go to our website, we have a tab that's virtual lactation. You can go online and reserve a 30-minute lactation consultation, look at the calendar and book it. And we are happy to do a virtual lactation consult with you if you're really concerned. You don't have to have your babies with us. You can just go check the calendar and book a spot, and we'll talk you, we'll talk you off the ledge on those nights. Many family members think the baby's starving. Often in the nurses and postpartum, everybody wants to help you. So it's easy to say, well, let's give the baby a bottle. That'll stop the baby from being hungry. Babies are not hungry. They just need lots of sucking. They also need what we call, there's a book, I'm a big fan of it. I think it's great to a degree, right? Take everything with a grain of salt. But there's a book called Happiest Baby on the Block. And it talks about the 5 S's. And for sure, that second and or third night of life, babies often want to be back inside your body. So they like to be cuddled. They like to be wrapped. They like to be skin to skin where they can hear your heartbeat. They like the sound of whoosh, 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 whoosh. So bouncing, sitting on a ball, shushing, putting your finger, the largest finger, either your thumb or your index finger or your middle finger. Even dads with big giant hands, any care provider, any family member with big hands, your biggest finger pad up in the baby's mouth as if they were sucking on your finger, right? All the way in where the pad flattens up against the roof of the baby's mouth. If the mom has been breastfeeding and you feel like the baby's fed, but the baby's still crying and you're exhausted, anyone can wash your hands nice and good, clip your nails if need be, and then you can put the largest finger, because we want to encourage the baby to open its mouth big and wide. The tendency is to put our little pinky inside the baby's mouth, at the tip of the baby's mouth, but you want your big finger all the way in the baby's mouth, up against the roof of the mouth. It's called suck training. And babies will suck on your finger. And if they are hungry, they will suck on your finger for a few minutes and then spit it out and keep crying. If they just need to be soothed, they'll soothe sucking on your finger. So sucking, shushing, swaying, swaddling, side lying. It's when we lie these babies down on their sides and just basically all the things that we do when the baby's been in utero. They're tucked tight in the uterus. They're being comforted as you're walking around during the day. And they often wake up at night, right, when you're pregnant with them. So you're trying to simulate that intrauterine experience for them. And it's really important on that second and or third night of life to help calm them down. So the breastfeeding person, if you know you're offering the breast every 2 to 3 hours during the day, and you feel like this baby's been nursing, but they're doing this behavior where they go to the breast, they suck, 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 pull off, bop their heads around, cry, arch their back, scream, go back to the breast, suck, 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 pull off, right? Those of you that have had this experience know exactly what I'm talking about. Those are gas behaviors. And so let someone put their finger in the baby's mouth. They won't prefer the finger to the breast, so don't fret. They won't get confused by a finger. And you're never going to leave your finger in a baby's mouth as long as you would a pacifier. So you're not going to leave that finger in the baby's mouth for 3 hours because you're exhausted. So you'll do it for a little bit, soothe the baby, slip your finger out, swaddle up, bounce, shush, rock. Baby starts crying, try the breast again. Not working, go back to all those other things, right? So I just want to add some encouragement for those people out there that have these brand new babies, and grandmothers often think it's colic. They feel like the baby's hungry. They want to give the baby a bottle. They want to give the baby Milacon or some colic soothing things, gripe water or something. Babies don't need anything like that on that second and third day of life. Some babies don't do that screaming thing, and that's awesome if that's the case. But many, many babies do. And when you're in the hospital, it's often thought that the baby's hungry, and you'll see I'm not expressing anything, I can't pump anything, I must not have any milk, the baby must be starving. That is not true. Babies have brown fat, this subcutaneous brown fat that they live off of until your milk is in. So all babies will most likely lose up to 10% of their birth weight in those first few days of life. And that is normal. It is not because they're hungry. So second and or third day of life, lots of crying, normal, normal, normal. Nurse the baby frequently, swaddling, sucking, shushing, bouncing, let the baby suck on your finger. Those are all appropriate things to get through the night. Your baby's not having a reaction to your soap. The baby loves you. The baby doesn't prefer other people to you. You didn't eat anything bad. It's not your shampoo. It's not the tuna fish you ate. It's not the broccoli you ate. You didn't do anything wrong. It's just a baby, and that's what they do. Now, as we get past this and now your milk starts to come in, babies will have a hard time going to the breast sometimes because suddenly they've been nursing and this breast has been soft and squishy because there's no milk in there yet. And now we're on the third, fourth night of life, and suddenly we have the onset of our milk and our breasts get really big and firm and hard, and it can be more difficult for the baby to latch at that point. So now we're getting into other issues. And again, the baby most likely has not regained its birth weight and is still doing some crying because that's what babies do. But we know that for first-time parents, most babies will regain their birth weight by all babies should regain their birth weight by the second week of life. Many are regaining by the first week of life. Most will regain by the second week of life. So those first 2 weeks, we just want lots of breastfeeding, no pacifiers. Pacifiers are associated with slow weight gain. So if you feel that this baby needs to suck, remember all babies have an innate need to suck that is not always related to hunger. So when in doubt, put the baby to the breast. Every 2 to 3 hours, the baby should get some deep nutritive sucking, about 10 minutes of good, deep nutritive sucking. The baby should be peeing and pooping. So remember, the rule of thumb is for every day of life until your milk comes in, we expect 1 poopy diaper, right? 1 poopy diaper per day of life, okay? First day of life, 1 poop. Second day of life, 2 poops. Third day of life, 3 poops. It's pretty simple. Now that your milk comes in, you have what's called transition milk, right? So this milk is transitioning, so the baby's output is going to start to increase from 1 diaper per day of life to 6 to 8 diapers once your milk is in. So you're going to start seeing lots more wet diapers, and the stooling is anywhere from 1 poop to 10 poops a day or more, right? That is normal. The stooling, there's lots of variability in poopy diapers. But your baby, once your milk is in, should start more copious output. So we tell people take 8 diapers out at the beginning of the day. So 9 a.m., take 8 diapers out. stick them on a shelf. By 9 a.m. tomorrow morning, you should be down to either no diapers or 2 diapers, right? They should go through 6 to 8 diapers. So what's even better actually is put 6 diapers out. That's the minimum. As long as your baby goes through those 6 diapers, you're in good shape, right? You're in good shape. 6 to 8 wet diapers a day. And if your baby poops, in my world, if your baby pooped, your baby peed. You're in good shape. And remember that poop in the beginning is black and tarry. Then it goes to like a thick, like pudding, right? Kind of consistent of thick pudding and still brown. And then it goes to like this watery mud situation. And then it goes to a liquidy yellow, like imagine a jar of mustard. And you know how like if you don't shake it up really good, the first squish is watery and then the mustard comes out. That's a beautiful breastfed baby's poop. So it should look like that by like day 5. We're really starting to see this yellow poop as your milk transitions in. So the first 2 weeks of life are brutal. Okay, those are the hardest 2 weeks. The first 6 weeks are hard. The first 2 weeks, you just want to jump off the roof because they're really, really difficult. You're very tired. The baby's crying a lot. You feel like you're going to break the baby at any moment, like you're convinced that you're a terrible person and that you've broken the baby. It's really hard to break your babies. So offer the breast frequently. Lots of crying is normal. Check out that, I think you can watch it on Amazon Prime, Happiest Baby on the Block. Really great tips.
There's also a book.
There's also a book. I'm a visual learner, so
I think there's YouTube videos too.
Yeah, you can watch some YouTube videos on it. You can watch the whole video on Amazon Prime. You can order the book, and I think it might even come with a link, or probably a link these days and not a DVD. Back in my day, we used to get a book with a cassette. Aging myself. But anyway, so there generally is some kind of visual component that you can watch. And really, really helpful. I'm not saying that all babies should be swaddled 24/7, but certainly in those first few days of life, those babies like to be nice and tucked in, right? Because their startle reflex is going off, and it's waking them up, and it's irritating them, and it's all new.
Since you're on the topic of the shushing and the
shushing,
all that stuff, I think a lot of people have concerns about the shushing being harmful for their ears. Can you talk
really?
Yeah, it actually comes up because they're like, well, that's a loud noise. Will that hurt my baby's ears?
So remember, that shushing sound is really important. So back in the day, you know, your grandma might say, put the baby on top of the dryer, or they love the vacuum cleaner and they love blow dryers. Because when they're in utero, remember, it's really loud inside your body. They're hearing what's called the uterine souffle. They're hearing the sound that goes, it's your blood, right? They hear your blood swoosh, 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 and they hear your heartbeat. They're inside your body. It's not quiet in there. So unless you're at like a rock concert, I mean, that's the stuff that's going to damage the ears. But shushing really close to your baby, shh, shh, shh,
love it,
is really comforting. And really, truly, blow dryers, fans, vacuums, they love that sound. The white noise, I think there's probably, I don't have my phone, but there's an app that has white noise. Most people can relate to being soothed by white noise, even as adults, right? Some people have a blow dryer going. I mean, I know people that keep a blow dryer on.
There's an app for that. It's probably safer.
Yeah, it's probably safer, but that's not abnormal.
Yeah.
A fan going in the room, because white noise is really comforting. So babies really enjoy it, and you won't hurt their ears. Swaddling, of course, we don't want this baby swaddled up 24/7. Babies need to be able to explore their hands and move their bodies, and we want them skin to skin with a warm blanket over you, but sometimes they do like to be tucked up. And there is an appropriate time to swaddle your baby. And bouncing and swaying. I'm not saying shake your baby, but I am saying bouncing and patting really, you know, firmly. Babies really do like that. So those are all the things that are going to help get you to survive in the first 2 weeks of life, certainly in the first few days. If you have a yoga ball or a birth ball, we call them, or an exercise ball, you could tuck that ball into the corner of the room and sit on it and bounce your baby and shh, 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 do all that sound. Put your finger in the baby's mouth, getting them sucking properly. what that finger does, it also primes them to go to the breast because it helps them suck as if they were at the breast. Their tongue comes down and it does all the right movement, right? Which we say, you know, primes the pump, and it gets them to suck well when they go to the breast. So that's what I have for today. Just know that hang in there. Those first 2 weeks are rough, and your milk will come in, and put the baby to the breast frequently. Their stomachs are teeny tiny, itty bitty, so they don't need any supplementing in the first few days of life. If you have questions or you want some additional lactation support, go to our website. We're now doing virtual lactation. We have several people. We have to update the calendar because this is all new and we're trying to figure it all out. But we have several lactation consultants that are available to help you. And we're here for you guys. And you're doing a great job. And keep the faith. You're not alone. Participate in the conversation. Tell us what tips worked for you. Tell us what pitfalls happened and that you would do differently if you were to do it again, or if you did do it again. We want to hear the good, the bad, and the ugly. So thanks for joining us, and we'll see you next week. Bye.